A 4-year-old previously healthy boy is brought to the emergency department due to fever, abdominal pain, and frequent bloody diarrhea for 2 days. A few children at daycare have developed diarrhea over the past week as well. He takes no medications and has not traveled outside the United States. Temperature is 39 degrees Celsius, which is 102.2 Fahrenheit. Blood pressure is 110/70 and pulse is 90 per minute. Physical examination shows increased bowel sounds and left-sided abdominal tenderness. Which of the following is the most likely causal organism? Our patient is a 4-year-old boy presenting with fever, abdominal pain, and frequent bloody diarrhea with an acute onset. He's had it for 2 days. He is at a daycare with older children also being sick and having diarrhea. Our patient has gastroenteritis with bloody diarrhea. Let's go over the answer choices and see what organism can cause this. Answer choice A is Clostridium difficile. It is rare to have a C. difficile diagnosis without having risk factors such as antibiotic use, as well as hospitalization. Proton pump inhibitors also raise the risk of developing a C. difficile infection. C. difficile also just causes watery diarrhea usually. We won't expect a bloody diarrhea with Clostridium difficile, so we can rule out answer choice A. Answer choice B is Clostridium perfringens. This infection, this pathogen usually results from ingestion of contaminated foods. Most often due to ingestion of uncooked meats or improperly stored meats. Clostridium perfringens also would just cause watery diarrhea, not bloody. As a result, we can also rule out answer choice B. Answer choice C is enterotoxigenic E. coli. Enterotoxigenic E. coli will just cause watery diarrhea. Also, the transmission of enterotoxigenic E. coli usually occurs in developing countries. It is usually referred to as a traveler's diarrhea because people who often visit developing countries would get enterotoxigenic E. coli and have diarrhea afterwards. Our patient does not have a travel history and has bloody diarrhea. As a result, we can rule out answer choice C. Answer choice D is Salmonella typhi. Salmonella non-typhi is the one that would cause bloody diarrhea. Salmonella typhi, on the other hand, in contrast to non-typhi, is less inflammatory. As a result, it will just cause watery diarrhea. It also most often occurs in developing countries. Since our patient does not have a travel history and has bloody diarrhea, we can also rule out answer choice D. Answer choice E is Shigella sane, which is going to be our answer. There are 3 common pathogens that can cause gastroenteritis with bloody diarrhea. One of them is Shigella. The other 2 is going to be E. coli 015787, as well as Campylobacter. What we need to know about Shigella is that it affects the sigmoid rectal region. Remember, the rectum as well as the sigmoid colon are going to be located in the left side of our body, left lower quadrant. As a result, patients present with left-sided abdominal tenderness, which our patient has. Shigella also has a low infection dose. As a result, it most often is transmitted in community settings like a daycare, and it can be transmitted through contaminated food and water.